The health care reform we're debating today will impact every person in this country. Whether you're searching for affordable insurance for yourself or watching helplessly as a loved one is denied coverage. Every American stands to gain something through this historic legislation. In my home state of New Mexico, the people I represent don't just have a lot to gain from this reform, they also have a lot to lose if this reform is not enacted. For New Mexicans, the status quo isn't an option. That's because without this health care reform, our state is expected to experience the largest increase in insurance premiums of any state in the Union. In 2016, without this reform, a family of 4 in New Mexico can expect to pay an astounding $28,000 a year in health care premiums. That will consume more than 56% of that family's projected income for the year. Affordability is already one of the key barriers to obtaining coverage in my state. Since 2000, premiums for residents have risen 110%. As a result, almost 1 in 4 people don't have insurance, giving us the second highest uninsured rate in the nation. Enactment of this reform legislation would make as many as 249,000 middle-class New Mexico residents eligible for premium credits to ease the burden of these high costs. In addition, almost 238,000 New Mexicans would be eligible for new private coverage through the exchange or through their employers, and another 124,000 would be eligible for the new expanded Medicaid coverage. And for the families that already have insurance, they win too. They will likely see lower premiums thanks to the increased competition in the market. The bottom line is that with this reform, the vast majority of New Mexicans would have access to quality, affordable health care for themselves and their families. But reform will also benefit New Mexico's small businesses. In 2006, less than 35% of small businesses in my state offered coverage for their employees. That figure means our state ranks dead last in employer-sponsored insurance in the nation, a dubious distinction to say the least. I've talked to a lot of these small business owners over the past months, and they all tell me pretty much the same thing. I would love to offer coverage to my employees, but it's just too expensive. They say they're having a hard time affording insurance for their own families. To those small business owners, I say help is on the way. The Patient Protection and Affordable Care Act will help you provide insurance to your employees by providing federal tax credits of up to 50% of premiums should you choose to offer coverage. In addition to lowering costs for individuals and families and helping small businesses, this reform would also give our rural communities additional tools to provide quality, affordable health care for all of their residents. Of the 2 million people who call New Mexico home, about 700,000 live in rural areas. They're more likely to be uninsured and often must travel hundreds of miles for preventive or emergency care, if they're able to find any care at all. In this bill, we've included pay incentives to recruit more physicians, Madam President, more physicians to be recruited to serve in these underserved rural areas. We will improve dental services in rural areas. We will extend Medicare payments for ambulances in rural areas, and we will expand the telehealth programs so that rural residents may receive specialized treatment not available in their local areas. Finally, we've made sure that this legislation won't result in an unfunded mandate for our state government, which is already experiencing the pain of budget cuts thanks to the economic downturn. This legislation would require the federal government to cover 100% of the cost of the Medicaid expansion from 2014 to 2016. and 95% of that cost after that. When it comes to health care today, too many New Mexicans are living on a cliff, teetering on the edge of financial ruin. All it would take is an illness or a job loss, and they could fall into the abyss of medical invoices, bill collectors, and bankruptcy. For these New Mexicans, the status quo isn't an option. This bill offers a life rope to these New Mexicans to pull them back from the precipice. Passing it would provide stability and security to those who have insurance, affordable coverage to those who don't, and lower costs for families, businesses, and government. So this is a historic moment, Madam President. I urge my colleagues to join me in seizing it. So let's begin the debate on this long overdue legislation to reform our broken health care system.